Thank you.
Tánaiste, as you know, Letterkenny General Hospital was devastated by a flood last July. 40% of the floor space of the hospital was contaminated by the flood water. The response at that time from the staff and management, as those flood water was coming into the accident emergency department and running into the hospital, was nothing short of heroic. And indeed, Tánaiste, that heroism of the staff and management has continued since, with the extra hours they've had to work and with the establishment of temporary departments. Tánaiste, prior to the floods, myself and my colleague Deputy Pearse Doherty revealed that based on the number of inpatients going through the hospital per year, Letterkenny General Hospital had the lowest hospital budget in the entire state and the lowest number of allocations of medical staff. And of course, again and again, Tánaiste, patients have suffered in Donegal because of this injustice. Once again, as I speak, there is a crisis at the hospital's accident and emergency department. Such is the extent of that crisis that the INMO have said it's the worst conditions they've seen in 15 years. There are patients in the county and across the county being diverted to Sligo Regional Hospital. Tánaiste, I ask you, will your government remove the moratorium and allow the management of Letterkenny General Hospital to allocate the necessary nurses and medical staff to run the hospital effectively? Will you match the heroism, will you meet the heroism of those staff who have worked unbelievable conditions and hours to keep that hospital going? Will you meet them halfway and give them an additional allocation of staff to help them to do their jobs?
Thank you. Tánaiste.
Well, first of all, I do recall the flooding that happened at Letterkenny General Hospital. And I want to first of all agree with you, Deputy MacLochlainn, about the heroic work of the staff at Letterkenny Hospital. They have worked in very difficult circumstances and they deliver a very fine service to the people of the catchment area. And indeed, I had the privilege of visiting Letterkenny General Hospital some time ago and seeing that work for myself. In relation to the funding of the hospital and staffing of the hospital, that of course is a matter to be pursued with the HSE. As far as the government is concerned, the government is committed to maintaining the maximum amount of health funding possible in profoundly difficult economic circumstances, as we all know. And this year again, the HSE will have over €13,000 million available to spend. The amount that's available to the health service this year is greater than that budgeted at the start of last year. The government has met supplementary requests from the HSE to meet its requirements each year so far in the context of the overall management of the public finances. And the revised estimates that have now been published, it's the responsibility indeed of every department and every agency to live within the allocation. We were able to find, in the context of the revised estimates, 47 million extra in that estimate to give the health service extra to manage the delivery of health services. Now, the issue, obviously, that you raise about staffing, that has to be dealt with in the context of the Haddington Road Agreement. There are procedures that are provided for in the Haddington Road Agreement that address the whole issue of staffing and the requirements of individual hospitals, and that's something that has to be worked out between the hospital and the HSE within the framework that was agreed in the Haddington Road Agreement.
Thank you. Deputy MacLochlainn.
Yesterday, the daughter of Myra Egonal, who is an elderly cancer patient, told the story of her mother. She was brought into the hospital at 5 p.m. On Monday evening last, and for 14 hours she waited in that A&E in unbelievable conditions to 7 a.m. the following morning. Another woman who attended the A&E department with her husband reported the following. The whole unit was swarming and heaving with people, patients, bodies and staff. Our hospital was completely overwhelmed. There were no beds available in the hospital, and the emergency units was stacked to bursting. Tánaiste, they're just two stories. Both families praised the nurses and doctors to the nth degree, but it certainly wasn't them who failed those families and so many others. Tánaiste, your government's cutbacks and moratorium have led to this debacle. You know that, I know that, every TD in this House knows that. When are you going to remove the moratorium on vital frontline staff to prevent scenarios like these families have described? The dignity of their loved ones was taken away. That is no way to deliver a health service. And you know the reasons why. So Tánaiste, I implore you, you've talked about it. Everybody who knows about that hospital knows that the heroism was remarkable in keeping that hospital going. 40% of its floor space contaminated, unprecedented crisis for a hospital.
Thank you.
For them to have worked the hours they have done and done what they cannot continue to be failed. They are literally a breaking point in terms of not just the A&E but other departments. Will you stand up now, remove the moratorium and stand by the staff and management of that hospital?
Tánaiste.
Well, first of all, obviously I don't know the particular circumstances of the case that you raised, but I will make inquiries about that. And I think because everybody in the country is entitled to get good quality attention and service when they attend a hospital. And I do know that the staffs of hospitals in Letterkenny and indeed other hospitals as well are extremely attentive to patients when they present, and they do an outstanding job, and I think the public, rightly is in their debt for that. The staffing arrangements in hospitals was addressed during the Haddington Road Agreement, and that provided for changes to be made in rostering arrangements, and overtime arrangements and staffing arrangements generally. Some of that obviously has to be worked through at individual hospital level and worked through with the HSE. The provision is made, I think there is something in the order of about 5 million hours overall nationally that is to be worked through in discussions at hospital level and with the HSE. These arrangements have been agreed by all of the unions in the hospital and in the health service. It's now a matter of working those through and to ensure that the public get the attention that they deserve when they attend hospital, and indeed that the staffs of the hospital get the support that they need and that they deserve.
Thank you. Deputy